What's going on, everyone? Happy Wednesday. Hopefully everyone is doing well, staying safe, healthy, having a great day so far, and I really hope you are testing negative for all those viruses. It is time now for the Wednesday edition of the Virus Update for Wednesday, August 27th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of different viruses out there, and you need to be informed of what's going on with these viruses. That's what I do here on my channel each and every day. I give you the latest news, data, and anything I can find to help keep you safe and informed of these viruses. Want to stay informed? Subscribe down below. Give this video a thumbs up if you like it. Hit that notification bell. Share this video with anyone you know. And if you're interested, leave a comment down below and maybe consider becoming a member of our Patreon page. Alrighty. There are several news stories today, and some not so good. First off, this in New York State, measles case has been confirmed in Rockland County. That's right. Medical professionals in the Hudson Valley. This is just north of New York City. Where it used to be called the Tappan Zee Bridge, where the Cuomo Bridge is, down in that area. Medical professionals in the Hudson Valley are on high alert in response to a measles case being confirmed in Rockland County. Officials with the county said the case was confirmed in a Rockland County resident after returning home from traveling a week prior where a potential exposure had occurred. Known contacts are being traced and evaluated for immunity, according to the county. So yes, Rockland, New York is dealing with a measles case. All right, just going to read a headline here. Indonesia launches measles vaccination campaign after 17 have died in their outbreak. That's right. This is not good. They have already had 17 deaths in their measles outbreak. So that is relatively concerning. Moving on now to this from Jammer. This is not good. I saw people with masks. I'm just going to read what he put here. And this is a quote from an article. I saw people with masks and thought, are they still scared of COVID? Now the joke's on me. Yeah, there's a lot of people that think that, oh, he's in a mask. Oh, he must be sick. Or, ha, 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 he's still wearing. Well, you know what? There's reasons for it. COVID's still out there. COVID still exists. 26-year-old, after her sixth infection, crushes her as Israel's vaccination rate falls below 1%, among the lowest in the world, and hospitalizations rise with 276 deaths in just the last 30 days. I think we learned something pretty big here. We often get comments here on the channel. We get comments over on X. Believe it or not, we've had one or two on Blue Sky. Yes, trolling can happen on Blue Sky as well. So many people comment and say, it's the vaccine, it's the vaccine. Well, Israel has just, the vaccination rate is now below 1%, and they're still having 276 deaths in the last 30 days. That sounds pretty bad, doesn't it? Sounds like they're having a pretty serious wave right now of COVID. All right, moving on to Ireland. Yeah, we have a lot of international updates today. Sligo University Hospital is dealing with COVID outbreaks impacting 4 of those wards. Children should only come if patients and visitors with symptoms must stay away until fully recovered for at least 48 hours. This is coming from Dennis the COVID info guy. So, yes, Ireland dealing with a COVID outbreak. And I believe we do have more from Ireland. Yes, here we go. Glador has posted this chart. COVID in the Republic of Ireland. Weekly confirmed COVID cases in the Republic of Ireland. And things are continuing to rise. Take a look at this chart. Yes, COVID cases are really rising. And mind you, we still have that issue. I usually like to show my at-home test, but we still have that issue of people not going to get a test, or they're just not testing at all, or they're using the at-home test, and because of that, the real numbers are not showing up in the data. Nonetheless, COVID is on the rise there. Moving on now to New Zealand. COVID weekly update for August 18th to August 24th, 2025. New cases, 531. Reinfections, 302. Reinfections make up 56.8% of the cases, and cases themselves are down by 8.9% this week. Deaths, they are still seeing quite a few. 16. That's up by 128.5%. Total deaths, 4,776. That's up by 16. Hospitals, 62. That's up by 6.8%. So some things here are still rising. 56.8% of cases there were reinfections. Sadly, they had 16 deaths reported today. COVID attributed deaths, 16. Not COVID 2. Not available. Says negative 2. One was in their 60s. 4 in their 70s. 4 were in their 80s. 7 were over 90 years old. So the problem there is clearly in the older population for this week's update. Could be different next week. Taking a look at COVID over in Italy. 1,312 cases in the last 30 days. 42 cases among healthcare workers in the last 30 days. 62 years is the median age of cases in the last 30 days. Again, it doesn't include at-home tests or people that choose not to get a test. 49% of the cases are males. 51% of the cases are females. Deaths in the last 30 days, 11, and 659 people have recovered in the last 30 days. So that's good to see that some people are, in fact, making a good recovery from it. All right, moving on to this, back to New York City metro area once again. Remember there was a Legionnaires outbreak there? Well, that first one, it's still there. There may still be some people sick. Another case or two may still pop up, even though that it looks to be that they are getting it contained. Well, guess what? One starts to end, another one happens. My moderator on my site, datareport.info, shared this yesterday. Steve, global moderator, a new possible outbreak of Legionnaire's disease has occurred in New York City, which is unrelated to the present outbreak. There are at least 2 cases of Legionnaire's disease in the Bronx at Park Chester South condominiums after residents tested positive. So we're starting off with 2 cases, and as we know from the last wave, this could grow. This is something we're going to have to keep an eye on, and I think this this is a tracking thread. I think this is going to be moved. I'm going to move this over into the tracking threads section. Alrighty, moving on now to air qualities. Hey, before we do that, I got to mention something. I got to thank you all. Yes, I owe everyone a big thank you. We crossed a milestone yesterday. The channel has now hit over 9,000 subscribers. The goal for this year is 10,000. Hey, we're at August 27th. We're very well on track to meet that goal, or maybe even past that goal. And I don't know if it's because we're in a COVID wave right now. I noticed our impressions on YouTube have been going upward. Gotta try and figure out how to catch some of those impressions, but nonetheless, we are growing, so that is fantastic. Thank you to everyone who subscribes to my channel. All right, taking a look at air qualities. We can see here the West Coast. Yeah, there's yellow, there's reds, there's oranges. Yeah, things are still not going well there, and it's going to be the case for a while. Wildfires are a problem. The Pacific Northwest is seeing above average temperatures. It's dry. It's conditions for these wildfires to continue to spread. We're also dealing with some sort of bad air qualities in the southeast as well, in portions of Texas, Louisiana, to a degree parts of Florida. Where it is not bad is the Northeast. The Northeast is doing really well. The heat has subsided. The Northeast here, we were really cool last night. In fact, I actually got down into the 50s last night, which is fantastic. All right, I have to show you EMS calls. They are not good whatsoever. Take a look at all these calls in Florida. And breathing problems showing up 1, 2, 3, 4. At least 4 times. A sick person, yeah, there's a couple of them. But the point is, they're still dealing with a high number of calls in Pinellas County, Florida. Philadelphia, we'll have to see if that updated or not. We're recording early today. No, still no update for that, but the suburbs have been extremely busy. The counties outside of Philadelphia. Take a look at Montgomery County. This was at 22 incidents just a few minutes ago. Yeah, it's still at 15. It could easily go back up again. You can see there's a lot of different calls, stroke, respiratory emergency, stuff such as that. Let's take a look at Chester County, Pennsylvania. Hopefully that is not as busy. It is. There's respiratory difficulty showing up twice, sick person, falls, heart problems, stroke, hemorrhaging. Yeah, there's some problems going on there. Taking a look at Bucks County, Pennsylvania, and you'll see there's only 4 calls there right now, so that's good. That's not bad. Respiratory distress is one of the calls. All right. Taking a look at hospitalizations, then I do have a surprise for you. The hospital situation, I should say. And it's not bad. You can see just a couple of hospitals dealing with problems in the Lehigh Valley. One in Gettysburg. That may be from, yeah, that has not updated from the other day. I don't know why. And this hospital over in Paoli has not updated since yesterday. Wow, at that time they had 21 admissions, boarding, and emergency department. High patient volume, high everything. Yikes, that's not good. All right, time now for a surprise. Aha, you haven't seen this in a while, have you? It finally updated. Pennsylvania finally updated its wastewater dashboard with some bad news. Yeah, take a look at this. Now, I don't know why they're saying Saturday, August 30th. We haven't had August 30th yet, but nonetheless, here's the bad news. Pennsylvania's COVID levels in wastewater have now gone to moderate. You can see there's a lot of wastewater sites here that are coming up moderate. We see Erie, Pennsylvania is coming up high. We also see some other portions of Pennsylvania starting to come up high. And we do have high down there in York, Pennsylvania as well. Let's take a look at that. That wastewater site hasn't actually updated. And in southeast Pennsylvania, yeah, things are moderate. Even, I believe, what is that, Norristown, Pennsylvania? Yeah, Norristown looks like, yeah, that's going upward as well. So things are trending in the wrong direction here in Pennsylvania. Let's take a look at the dominating variant. That is clearly the XFG variant. You can see here, XFG is 69.31% of the cases. How about influenza? Any problems with that? No. And RSV at this time? RSV is not giving us any problems here in Pennsylvania at the moment. Taking a look at New Jersey. And let's refresh this, shall we? New Jersey at this time, Inspira Medical Center, Mullica Hill. Full and total divert for patient volume. And that is the only hospital as of this morning. There may be more in the afternoon. Like I always say, hospitals tend to get busier in the afternoon. All right, New York State. Some bad news about this. 507 new positive cases. But what you do not see here is you're not seeing... You notice how the cases were dropping? You're not seeing that corrected here. Well, apparently there was behind the scenes a correction. CJS will have about that tomorrow. Yeah, we thought it was kind of odd that cases were dropping. Well, it was. And apparently there's a lot of cases that did not get shown here. And we may see that from CJS if he gives us an update later today. Hospitalizations do show it. Take a look at that. They continue to go higher. 413 people hospitalized in New York State. 43 people are in the ICU at this time. So, yeah, New York State, trending in the wrong direction. I think we should take a look and see what's going on with New York City as well. There was, like I said, there was clearly an error. We knew it was wrong that their cases were showing down so much. Yeah, take a look at New York City. Their hospitalizations went from 158 all the way up to 188. And again, statewide level, we can see here, they now have 413 people in the hospital, 43 people in the ICU. Let's take a look at newly reported hospital admissions. And they're actually similar to what they were last week. But I wonder, did they go up in New York City? They did. Wow. New York City had 93 admissions. And on the Tuesday update of last week, they had 66. We don't have Wednesday's numbers yet. They'll come out later. We'll get that into the Thursday edition of the virus update. We may even show Thursday's numbers tomorrow as well, because we like to wait for UK, Ohio in tomorrow's update. All right. We're going to take a look at some wastewater next. But before we do that, let's pause and take a hydration break, shall we? Water was the drink of choice today. All right, take a look at the wastewater map here from Wastewater Scan. Still, it continues to be high in all regions of the United States. And this really is a problem. I mean, there's no region of the United States that has been spared from this summer surge of COVID. Let's start in the Northeast. Let's do some wastewater sites in each region because things are not going well. Take a look at Portland, Maine. Yeah, things are continuing to rise there. It slowed off for a little bit, but now things are back to going up there once again. And let's see what's going on in New Hampshire, Dover, New Hampshire. You can see, take a look at this. They had a significant rise through much of August. Then it dropped a little bit. Now it is starting to go up there once again. That is relatively concerning. Let's take a look at Boston, Massachusetts. That is a big city. And in Boston, Massachusetts, we see COVID's listed at medium. It has dropped slightly, but I wonder, are they dealing with a norovirus issue? No, they are not at this time. They are not dealing with a norovirus issue. That is some good news. Take a look at this. Hollywood, Maryland. And they have, yeah, look at that. The COVID wastewater level there just continues to rapidly go up, which is not good whatsoever. Norovirus is also listed high there. And then if we come even further south, there's only 3 wastewater sites in the state of North Carolina. I wish there were more there. I wish there were more in a lot of states here at Wastewater Scan. All 3 of the wastewater sites in North Carolina are now listed at high for COVID. Let's take a look at Winston-Salem. Yeah, that's still rising for COVID at this time. Also, HMPV seeing a little bit of an increase. Now, that is still listed at low, but it is rising there at this time. So, that's rather interesting and not good to see. Now, a little bit of good news. Take a look at Atlanta. Remember, all the wastewater sites were high? Well, there's 3 now that went to a medium. That's some good news. Maybe, just maybe, we're going to see Atlanta area start to peak pretty soon. We see South River, Atlanta, Georgia. You can see that's still listed high. It's still rising somewhat. Norovirus is going up ever so slightly, but is not a major concern at this time. Let's go down to Florida. Let's see what's going on in the Miami area, shall we? North Miami. Are things still rising? Unfortunately, yes. Things are still rising for COVID in North Miami. And norovirus is listed at medium. That's kind of normal for Miami, and I'll tell you why. They do get a lot of the cruise ship activity that comes in there. And as we know, cruise ships can be a petri dish when it comes to COVID, norovirus, and any of the other viruses. All right, St. Petersburg, Florida. We're going to look at all 3 wastewater sites here. Southwest region is dropping for COVID. Let's take a look at the other one, if we can. There we go. And we can see when we take a look at that, yeah, it's still rising ever so slightly. Is also still listed high. Norovirus is rising slightly as well. Wanted to bring that to your attention. Now let's go over to the Northeast Wastewater Center there and see what's going on. Yeah, Northeast St. Petersburg still listed high, but COVID is dropping in that region as well. Now let's go just a little bit more to the west. We want to take a look at New Orleans, shall we? Because New Orleans has been getting hit so hard. The emergency departments in Louisiana are just absolutely ridiculous when it comes to COVID. And look at this. Yeah, these wastewater levels for COVID are very high. Norovirus is not an issue yet, just a minor increase, still listed at low at this time. All right, let's check Texas. How about we go to the Dallas metro area? How about we go to Southside Dallas, see what's going on there? I believe this is a pretty big wastewater site. Yeah, 421,000 population. COVID in wastewater is still rising there. We do not see the norovirus issue, and we don't see issues with other viruses. Some detections of hepatitis, but we generally don't get overly concerned with that particular virus. Taking a look at what's going on in Las Vegas, and let's see the COVID levels there. They dropped a little bit. They are listed at medium, though, and norovirus is listed low at this time. And let's take a look at California, shall we? How about we go up to Sacramento? And in Sacramento, California, COVID levels are still high. Need to start seeing them coming down soon. Norovirus is seeing a slight increase there. Measles detections, there were plenty of them early in the summer, back in June. Let's move over now. How about a little bit further to the north? How about we see what's going on in Boise, Idaho, West Boise, Idaho. And there we are currently seeing, yeah, COVID went up and then there was this wonky movement downward. I think we can X that out because that's probably not really the case. So, yeah, your levels are high. Your norovirus levels are listed at medium at this time, but they are on a downward trend. Making our way a little bit further to the east. Again, Montana, Wyoming, nothing here. And we did not have that update from the CDC last week, which is problematic. North Parker, Colorado. We can see here, yeah, your COVID levels are still high. Norovirus is rising ever so slightly. All right, ending in the Midwest today. And let's see, where do we want to go in the Midwest? How about we take a look at Ohio? Akron, Ohio at this time is listed at high for COVID. You can see here, yeah, overall you have been trending upward, and that is not good. Also some detections of hepatitis A. So COVID high there and continues to rise at this time. Let's go over to, how about we come up to Mount Pleasant, Michigan, because this wastewater site has not been doing well at all. When you see, you're still listed high for COVID, but take a look here. Wonky movement at the end. That may get corrected. Norovirus has been increasing there, and there has been a detection of hepatitis A. Alrighty, folks, that does it for the midweek Wednesday edition of the Virus Update. If you enjoyed this update, give it a thumbs up. Subscribe if you're new down below. Hit that notification bell. Share this video with anyone you know. Leave your comments down below. And, of course, if you want to become a member of Patreon or support the channel in any other way, do so through the links down below. I will see everyone again next time, which will be tomorrow. Until I see you again next time, stay safe, everyone, and have a fantastic Wednesday afternoon. Thanks for watching.